Hi, strep throat is a very common bacterial infection that affects mostly school-age children, sometimes adults. It's caused by a bacteria, usually group A Streptococcus, and that's what the rapid strep test looks for. Sometimes it can be other types of strep that don't show up on that, but most commonly it is group A strep. So what kind of signs and symptoms are you going to have if you get strep throat? Usually it's a severe sore throat, redness of the tonsils. Usually there's a white, we call it an exudate, but it's pus or white material on the tonsils, and a high fever up to over 101.5 sometimes Fahrenheit. This can last for up to a week if untreated, and it's important to seek medical treatment for this because untreated, it can lead to serious complications like abscesses or systemic infections like rheumatic fever or scarlet fever. And typically this is treated with antibiotics, and within 4 doses or 48 hours, you're no longer contagious. This can happen many times in school-age children, and when that does happen, that's often when you're referred by your pediatrician or primary care provider to see an ear, nose, and throat doctor. Because if you have more than 3 infections a year for 3 years, 5 infections a year for 2 years, or 7 infections in 1 year, you kind of reach the point where the risk and benefits shift toward the fact that getting your tonsils out with tonsillectomy is worth doing.